So I'm Yvette Markey. I am a certified addiction peer recovery coach, level 2 with the mental health endorsement. And I work for MHAI, Mental Health America of Indiana, with the Indiana Recovery Network, Indiana Addictions Issues Coalition. So there's like slash, slash, slash. But it all goes together, I promise. So yeah, I work to help individuals who are pushing through mental health and substance use challenges and the things that come as a result of those challenges, such as homelessness, poverty, and all those things. So, the peer part of my credential is essentially me, because I have the lived experience of the substance use, the mental health, and the homelessness. So that's why I do what I do. Homelessness is, for me, it was shameful, from the standpoint of, for me, I have four adult daughters. They're grown now, but raising four daughters, I always try to be mindful of what they would see, what they would hear, what I would do, so that they wouldn't have to see or hear. And part of that was, while I was using, I wasn't making the best choices, so I'm taking monies that should have been going for bills and buying drugs, okay? So that put us in a situation where we didn't have anywhere to live again, or didn't have anywhere to live. So it was the first time. And that was the one time for us as a family, because then what I did was make sure they had places to live. And so I still did it. Yeah. So whether it was in a car or an apartment building, once I knew that everybody went to bed in that apartment building, or if it was someone's couch, someone's basement, the street. So it came with a lot of shame, which didn't help with the drug use. It actually enhanced my reason for using and my and that was my reality. Like, I didn't want to feel that. I didn't want to be that, But how do you get out of that when you're having streets or not knowing that you have a place that you can go to and be safe and have food and, your own space, having that and then not having it is traumatic. It's desperation. It's all kind of feelings came up for me and went through me as I was trying to go through it. Desperation, thinking, what can I do to get enough money to all kind of thoughts. And so it's to where it scared me, actually, because that desperation had gotten to a point where we're thinking, not rob, steal, or kill, but how can I get what I need so that I can get back to the house with my own kids? Making the bad choices to go into a store to steal, to be able to get a hotel room for my family or my drugs. So I racked up a criminal record because of that. That didn't help me with trying to get a new place to live. I was actually working backwards in my mental health and substance use challenges. I wasn't in my right mind to make those right choices. I made bad choices. And it took a while to understand that I needed to make better choices if I wanted something better for myself and family. And so, you know, and I don't say that like it's an easy thing, because it's not, but to make a conscious choice to say, let me try to do it. You know, so for me, it was a lot of fear, just because it was unknown. Here I am. I've made this bad choice one too many times, and now my family's on the streets. Well, I'm on the streets.
Mm-hmm.
So, you know, I don't think there's a particular word that, other than fear, that comes to mind first for me.
Yeah.
Because I was scared to death. I didn't know what homelessness felt like until I did.
Mm-hmm.
And so with that, it allows me today to be compassionate and just a huge, huge advocate for people who are experiencing homelessness, families especially.
Yeah.
Because that was me. Homelessness looks like me today, but I'm not homeless. But somebody is. There's a woman somewhere that goes to work every day, that has children that she needs to care for, who is sleeping in her car. She said maybe they're on the street in the club. We don't know. But what I do know is it's a thing, and it's been a thing forever, and it's a thing. It's a huge thing. And there's not a simple fix, and it's heartbreaking every day that I have to say, well, we'll see how we can help you then. You know, just keep working at it and keep deciding to wake up every day, and we'll try to figure it out. So the only promise I have is to promise to help figure it out. Those that don't know, or those that have their prejudged picture, don't understand is, I'll say it again, homelessness looks like me. Homelessness can look like you tomorrow. Some people are one paycheck away from it. And it could be just this week's paycheck that just doesn't add up. I just decided to keep working the program that I was working, keep going through the job training. And ideally I'll get a job and I'll get a place, and I did. But that wasn't, that was where the struggle was. Because now you gotta try to identify and justify why you have this record. And you gotta persuade people that you're not gonna steal from them just because you got this record. But then nobody's ready to have them conversations, because it's just, no, you have a felony and you can't do this. And just that, and so for that was hard, because how do I get past that? I can't, this is here. What do I go do? You got eviction on your record. How you gonna, you know, all those barriers was enough for me to start back using. And it's a cycle. This just went through the whole process again so I decided that I'm gonna stop smoking crack 3 different times in the 4-year period that I was in active addiction, until, I did that, like I said, 3 different times, and the 3rd time, it worked for me, and so I went back to school. I went to Ivy Tech, and I got my Associate Applied Science for Human Services, with the direct support professional credential, because I wanted to be directly working with people, and I want to be clear about that. So I did that, and that was a highlight for me. Like, that was and I graduated in 2012. So that was a huge deal, and I knew then that honestly I feel like I could do anything. And so then here I go, and I'm going to create this business plan, and I'm going to have this organization, and I'm going to help people help themselves. And I'm going to call it intended to have an organization or to be a member of a recovery community with an organization. My sole intention was just to do what I'd been doing. It was just to help other people, help themselves, just to share what I knew because of my experience. And if anything, I can share with you what not to do. I might not know what to do. I don't know what I'm doing yet, but I do know what not to do. I started to be like this beacon of information, just me, for people, anybody that, and it got, so good that people would say, well, you can call Miss Yvette, she probably knows. If she don't know, she knows somebody that knows. And so, and that's where that's where I'm at, and that's what I do. If I can just touch them and help them to understand that I understand, and just give that encouragement, because it's many days you just want to go head off into that thing that you're using and just be done, So if I could be a glimpse of hope, that there is something out here, it just takes time, and you have to just agree and tell yourself that you want to keep showing up for yourself and your family to get to where you were before homelessness happened. It happens. I'm living proof